die! Somebody help! Don't let me die, Butters!
These Butters are trying to help. Cringe-worthy doctor appointments, tooth fairy alternatives, and the ultimate tap dancing dangers. Get ready to hopefully laugh and learn a little, because today we're breaking down and reacting to some of the most unhinged medical scenes and head-shaking injuries from South Park. Let's dive right in.
But just real quick.
Oh, there you are, Mr. President. I need to talk to you.
No. Brandon Carr, no.
Whoa! Oh!
When people fall down the stairs like that, we'll get people showing up to the emergency department, and usually it's for rolled ankle or a busted wrist or a dislocated finger. That's usually the injuries that we do see. Sometimes people will strain their back. Well, there you go. We have a seat collar on. This is not one of those rigid seat collars. Then we have a straight long arm cast placed on the right arm. Usually there is some bend. On the left forearm, you see these pieces of metal on the outside. That's an external fixator. That allows doctors to adjust bones from the outside versus on the inside.
All right, well, I'm very sorry, but you do appear to have toxoplasmosis from exposure to cat feces.
In feces of cats, yes, you can have something called toxoplasmosis, also in undercooked types of meats. Most people, if they do get it, they don't even know they have it. But people who have immune compromise, HIV patients, people getting chemotherapy, pregnant women, it's a little bit more worrisome. There are treatments out there with antiparasitics.
Stop talking about climate change during lunch time. Okay, let's sit down. Some of us are trying to just enjoy some simple goddamn barbecue ribs. And oh God, they did it to me again, Butter.
What do? Somebody clutches their chest, or they have that classic sign called the Levine sign. Somebody's complaining of chest discomfort, call 911, lay them down, have them try to calm down and relax so where your adrenaline is not pumping, but they need to get to the hospital ASAP, get an EKG.
Don't let me die. Somebody help! Don't let me die, Butters.
These Butters are trying to help. If you're like Cartman and get a little worked up from time to time, you might want to take a look at Chillax. It's not for cardiac events, but for Cartman level stressors. Check out Chillax at lifehappens.com or on Amazon.
Canada Channel presents the Queef Sisters.
What? Is that their name, or are they using the sound that might come out of a genital area?
All right, Queef Sisters, it's time for your yearly pap smear and vag exam.
Yearly vaginal exam and pap smear. So typically that's not the case. Depends on where you are in life. If you have multiple partners or you're in a relationship for a longer period of time.
All right, doctor. I'm ready, doctor. Now I'm just going to check for cysts.
You typically wouldn't be having like a social exam where you're having multiple people in the same room in stirrups like this. Quite awkward, and you would also cover the individual for their dignity. So again, weird scenario here. The only cysts that you might see on the outside are typically called Bartholin cysts, and they're actually on the inside. Usually if somebody has those, they're quite painful if they're very large.
What kind of network are you running there in Canada? Don't call me buddy. I'm not your buddy.
Hey guys, we have a little surprise for you.
Butter's whole head is wrapped with an ice pack or some sort of pack. It could be warm. It's a little cartoony. If you need ice, we'll put it on top of your head, but you would potentially hold it versus somebody wrapping it like this.
Hey, Butters. How you holding up, man? Hey, fellas. We got you a present, Butters. I'll put it here on your nightstand because none of us want to touch you since you got queefed on.
Yes, there are viruses that spread through the air. Is there a likelihood a virus through the vagina that spreads through the air? Not that I've seen, because it probably doesn't happen very often. I can't say with 100%, but not something I've seen come through the emergency department.
Okay, the string is tied to Kenny's tooth. You ready over there? Almost. You ready, Timmy? Timmy!
I don't know about you, but an automatic wheelchair or electronic wheelchair, I don't think goes fast enough to pull this out, but they have attached him to a pole so he doesn't move, but I'm not sure it's a good thing.
You slam your electric wheelchair into high gear, okay, Timmy? Timmy!
Right, you're Timmy. I'll tell you why it has to be you, Kenny. Because your family is poor and therefore has bad oral hygiene. So your teeth are gonna fall out someday anyway.
When people come into the emergency department for dental issues, we are a temporary band-aid. We do not do full-on dental care in the emergency department. There are no dentists that actually are in the emergency department. Very few. They might have dental residents around, but of my many years of doing this, I've only seen it like once or twice.
What are you doing? What does it look like we're doing, Butters? We need a tooth, so we're using Timmy's wheelchair to pull out one of Kenny's. Oh, hey, I got a loose tooth right here. You what?
If there's an avulsed tooth, if it comes out and you have the tooth under a certain time period and it might be viable, we'll actually put it back into place and then splint it there. If there's an abscess, we'll typically cover you with some antibiotics. If there's dental pain, we'll probably give you some pain medication.
You guys, I can see Kenny's little pangling.
Ouch, that would hurt. The fact that your tooth is that wedged into your bone, that's good that didn't come out, but I would assume it would take the tooth out.
It's my son. He's lost a lot of his baby teeth, and I was starting to get worried.
Well, losing baby teeth is a natural thing, Miss Cartman. How many has he lost?
About 112.
Yep, nope. Children have 20 teeth, and then when those fall out, you have your 32 teeth as an adult that come in that are permanent. How many of you still have all 32 teeth as an adult? Let me know in the comments. I am missing 8 of those 32, but I eat food just fine, and you see this happy smile.
There's something about the pocket.
A light coming off the ceiling and causing a crush injury to somebody's head. That is a massive amount of trauma for how far it fell. Does not seem compatible with life, but you don't stop there. If the patient is breathing, has a pulse, you bring them to the hospital, evaluate, and see if there's something that can be done. Oh my gosh. Puncture wound straight through the back into the thoracic cavity. We see ribs breaking apart, coming out the front, probably puncturing through the heart, probably not compatible with life. This is a medical nightmare. Getting electrocuted, see how somebody is being stuck to it. That's because of the flexion that occurs when you have AC current going on. Alternating current makes you hold versus direct current makes you kind of explode backwards. Oh, here we just have intestines hanging out. You see the person trying to put it back in. That's due to the fact that you're a little bit in like a mental shock, usually due to either pain, euphoria from the hormones that are released in your body, or because you're hypotensive, not getting enough blood flow to your brain. Oh my gosh. Trampling injury. You see a lot more in the news lately because of a lot of people in gatherings and concerts. Besides the direct trauma that people may get, skull injuries, intracranial bleeding, you can actually crush someone's chest so they can't breathe, but you can also suffocate them so where they can't breathe just because of the amount of people that are on top of them. If you guys enjoyed this, definitely let me know in the comments. And as always, definitely binge watch this playlist right here. Watch everything. Please subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.